The gentlelady yields. The gentleman from Georgia, Mr. Allen, is recognized for his 5 minutes of questioning.
I thank the chairman. Dr. Lynch, HRSA details several examples concerning interactions with patients' families and obtaining consent from next of kin. In one of these interactions, the report describes how OPO staff proceeded with obtaining authorization from 2 family members despite witnessing the next of kin take psychoactive medication immediately prior to the discussion. Are there or should there be protocols in place that do not allow for consent if a family member or next of kin are under the influence?
As a non-lawyer, I will speak in a generality, but I believe local, state, and federal laws address consent, and making sure that an individual has the capacity to do so involves their mental state, yes.
Okay. There have been concerns about the risk of conflicts of interest in the organ procurement and transplant system, particularly as it relates to UNIS and OPTN. And your testimony notes that UNIS was the only entity to hold the contract to support OPTN for the past 40 years. As a result of that, the board of directors responsible for OPTN governance was the same as the corporate board of UNIS, which created a potential conflict of interest. What insights do you have into these potential conflicts of interest, and what is being done to address those issues?
So that was a source of strong concern that was noted by multiple congressional investigations, the lack of objectivity, the lack of independence for a board that feels that it has to answer to the OPTN, the government entity, and also to the corporate entity, to the contractor. So making sure that they were independent boards from each other, and then making sure that the individuals who occupied that board had the best information and had a clear understanding of their obligations to the OPTN was a key part of the modernization initiative. With the authorities granted by the Securing Act in 2023, we were able to achieve that aim. And we had a special election this spring. The new board has been sworn in on July 1, and this election actually had an unprecedented high level of turnout from within the community. So we believe there is excitement and enthusiasm for this.
Good. While the report analyzes cases across KYDA's regional jurisdiction, HRSA's analysis found that there were disappropriate gains in procurement in certain sectors. What kinds of trends did you see with organ procurement in smaller, more rural hospitals?
So we found 2 trends in the smaller hospitals relative to larger ones. The first was that there were more cases that did not proceed to the recovery of organs relative, essentially the number of times they tried was lower. And then in those cases where they did not proceed to organ recovery, there was a higher instance, a higher rate of concerning findings in those smaller hospitals.
For additional context, the report illustrates that there were proportionally more A&R cases per successful donor procurement at smaller hospitals and those with higher proportions of rural patients, and that a higher fraction of the A&R cases at smaller hospitals and those with more rural population showed features of concern. Could you elaborate on those findings and what this means in the broader context of OPOs?
So again, the right to be an organ donor is recognized. This is something that if you've made that decision for care or your family makes that decision for care, it should be honored, and it should be honored in a safe, consistent way. The small hospitals, we believe, did not receive adequate support from the OPO. And that is based on a number of the features that we saw, specifically the interactions with staff.
Good. Well, thank you so much. And with that, Mr. Chairman, I yield.